Hi, my name is Rich Troyney, Executive Director of the Association, or the AAFD. Sorry, I'm switching hats here. I want to welcome everyone to our employer product town hall focusing on health benefits. I'm going to introduce our primary speaker, and then Stephen, you can introduce the other speakers as they come along and part of your thing. But I do want to welcome everyone. I want to say that as a former franchisee, health benefits is a critical component of running your own business, and oftentimes very difficult to afford or find the right solution. And that's why I'm thrilled to have Stephen and the team consisting of Harris and Patrick on the call as well. They're going to talk to us about some of the products and solutions that they can provide to us as franchisees and small business owners. And with that, I'll just introduce Stephen and we'll kick this off. Stephen is a 35-year veteran of the health insurance industry, 26 years of which he spent in senior sales and executive management positions at Aetna, Cigna, and Lincoln National Life, amongst others. Stephen's been affiliated with the AAFD in an advisory capacity since 2006, and during that time, he has assisted in the deployment of a number of employee benefit programs designed specifically for us as small employers. In 2021, he introduced the new AAFD Health Benefit Program, a suite of ACA compliant programs that address core employer requests, competitive price, rate stability, guarantee issue, guarantee price, and employer contribution flexibility. And for those of you who've been involved with small businesses over the past just couple years, never mind as long as Stephen's been working with us, it's one of those challenges that we all face, and we are all constantly looking for the right solution for us, our employees, and our families. Stephen holds a degree in business from the University of Miami and resides with his family in Boca Raton, Florida. With that, Stephen, I turn it over to you.
Thank you for that illuminating introduction, Rich. Appreciate that. Good afternoon, folks, and depending upon where you are calling from in the country, possibly good morning still. I'm Stephen Chapkin, Director of the AAFD Health Benefit Program, and I'm here today with Harris May, who's the President of Daphne Financial and a agent of Colonial Life, and Patrick Salkin, who's the District Manager of Colonial Life. And together, we're going to talk about the health benefit program that we put together specifically for you, AAFD franchisees. With that, we're going to kick it off as soon as I get this working. There we go. First, a little housekeeping. If we haven't already done so, please mute your mics until the end of the presentation. If you have questions along the way, please put them into the chat button, into the chat room, and we'll answer them at the end of the presentation. We've reserved about 15 minutes of time to answer your questions. The objectives of today's meeting will be to review industry trends. I will introduce you to the AAFD Core Health Benefit Program, and then turn it over to Harris and Patrick, who will introduce you to the Colonial Life Ancillary Benefit Program that complements and supplements the core benefits that we offer. And then we have, as I said, we have 15 minutes to answer any of your questions. So with that, I'm going to minimize the video portions because you don't want to look at my ugly mug all afternoon, and move on with the presentation. So let's talk about industry trends. We know there's record inflation. Nobody has to tell you that we're in an inflationary period. We all know this. You only have to go food shopping or stop at a gas station to feel the pinch in your wallet. But on top of that, we have the COVID epidemic. And if you think the epidemic is over, I think you're mistaken. It's just changed form, and we're just beginning to learn to live with it. I think it's going to be the new normal for a long time to come. But how many small businesses do you know that failed in 2020 or 2021 because of the COVID epidemic and what we had to do to combat it? By the government's own estimate, more than 100,000 mom and pop businesses are now gone. That you're still here is a testament to your business savvy and your stick-to-itiveness. So I applaud all of you that have weathered the storm. We also have what they now call the Great Resignation. Because of COVID, people were homebound, and some of those people decided to have discovered what they call side hustles. And those side hustles are businesses that they can work out of the home, and they've turned those side hustles into their main source of income. So if you're like me and you go to a restaurant and you see that there are not enough wait staff or kitchen staff, it's because of that. And I know that I've come to restaurants that I've frequented in the past, and the people that I've come to know are no longer there. And it's really had a negative impact in some cases on the service. And I don't have to tell you about the signs of recession. We don't know whether it's going to be a hard or a soft landing that we are in, but we are in a recession. We all feel its effects. And if the Fed continues to increase rates, there may be even more fallout. So let's see how that general inflationary period is reflecting medical trend. If we look at the left side of this graph, we can see that back in 2007, when we had the Great Recession, medical costs trend was up at 11.9%, and it's gradually reduced to a manageable number all the way through 2020. But in 2020 and 2021, it started an upward trend again. So we're looking at the effects of inflation and the recession on medical trend. The medical industry is not immune to inflationary trends that are affecting other sectors of the economy. Nurses that suffered from burnout have found other jobs. So we have a shortage of medical staff in our hospitals. New prescription drug developments, while they're great and they help people live longer, they're very expensive. And they are affecting our pocketbooks as well. But as you can see, we're going on an upward spiral again, in spite of all the things that we're trying to do to contain it. So let's look at the challenge of a small employer. This is a typical small employer, ABC service company with 25 eligible lives. They switched carriers last year to capture 5% savings. And maybe they increased their deductible to $3,000 single and $6,000 family as part of that strategy to capture 5% savings. But this year, they received a 12% rate increase, and the carrier is unwilling to negotiate. Compound that with the fact that the employer is struggling to attract and retain talent needed to keep up with business demand. And so they're searching for ways to manage overall costs while maintaining the value of their benefits. All of these trends conspire to put pressure on a small employer's ability to provide a quality employee benefit program at a reasonable cost, both for the employer and the employee. So what can the AAFD Health Benefit Program do to help you? Let's take a look. First of all, we have zero deductible on all plans. What does that mean to you? It's a great benefit because employees have first dollar coverage on their medical care, and that means less money out of their pocket for medical care. Secondly, all plans are copay driven, and I want to spend a little time talking about this because this is really important to understand. The payment methodology for copays is far superior to coinsurance, where you pay a percentage of the cost of care. So let's look at an example. The average cost of a C-section is $25,000. That's just the average across the United States, maybe more or less in your particular area. In a typical 80-20 health plan, the PPO would discount that cost by about 20% or $5,000. So the member's responsibility after deductible would be 20% of the remainder in an 80-20 plan. Let's assume that the member has a $5,000 family deductible. So after the deductible is satisfied, the member is responsible for paying 20% of the remaining $15,000 or $3,000. So the member pays a $5,000 deductible plus $3,000 coinsurance, totaling $8,000 out of pocket. But the member has a $6,000 out of pocket maximum, so it's capped and the member's cost is $6,000. But with a copay plan, a member pays a flat amount for each service. In the case of our plans, for instance, our hospital copay is $400 in some cases, $350 in other plans. And that includes surgery, the bed, any ancillary services that are part and parcel to being in a hospital, whether you're there one day or you're there 10 days. So the advantages are readily apparent with a copay plan. And in general, in 95% of the cases, copay will be superior to coinsurance. For you, the employer, since you are a small employer, many of you have a very small number of employees, if any employees at all. Sometimes it's just the husband and wife are the only employees. So we have a minimum participation of only 2 lives with multiple plan choices. So even with 2 enrolled employees, and those 2 can be husband and wife if they're both employed by the business, you can choose 2 plans down to 2 employees. If you have from 2 to 9, you can choose 2 plans. From 10 to 24, 3 plans, and from 25 or more employees, you can choose 4 plans. Another great feature of these plans is that they guarantee issue with no underwriting. What does that mean? That means that whether you're sick, old, in an industry that might not be considered favorable, we don't care. Same rate, every industry, no matter age, sex, health, geography, or industry. Your contribution as an employer is flexible. Most other carriers require either a 25 or 50% minimum contribution to the employee rate, premium rate. With this plan, with our plans, you can choose the contribution that works for you and your company. It could be no contribution, and you can allow the employees to take advantage of pre-tax deduction of their premiums, or you can put a flat dollar amount or a percentage of premium based on your ability and your desire. With that, we offer a national network of over 660,000 providers through one of the largest PPO networks in the country, PHCS. And our rates have been, most importantly to you because of inflation, our rates have averaged 2% for the last 5 years. And I can tell you today that the rates next year will be anywhere from 0 to 3%. So with that, I want to talk about our medical plan designs. But first, I want to talk about something called reference-based pricing, or RBP. In most plans, you have a PPO network that consists of a network of doctors and a network of hospitals. In our plans, we eliminate the network of hospitals. You have a network of doctors, but we eliminate the network of hospitals. And why? Well, for 2 reasons. First of all, you have greater freedom of choice. You're not limited to the network of hospitals, and one may, MD Anderson may be in the network and Baylor may not, or vice versa. You don't have that limitation with reference-based pricing. But more importantly, it's a methodology that allows us to be transparent about the cost of medical care. With the PPO, prices are negotiated between the insurance carrier and the hospital network, and those prices, that negotiation is proprietary and confidential. So you'll never know what that discount is, and I don't think that's a great way to do business. On the other hand, with reference-based pricing, we use public information to provide you with the rate for hospitalization. We use the Medicare reimbursement rate, and the Medicare reimbursement rate is published in every sector of the country, so you know exactly what it is. And we pay 150 to 200% of the Medicare reimbursement rate. So if a hospital accepts Medicare as a form of payment, and at least 95% of all hospitals in the country do, they will accept RBP. There are a few pockets in the country that don't prescribe to this methodology, but I would let you know beforehand. So now that we've talked about reference-based pricing, you understand that. I'm going to just give you a brief overview of the plans that are available to you, because if I showed you every plan and went through every benefit, your eyes would glaze over after the second one. But I'll be happy to go into greater detail on a separate call if you like. So we have one entry-level plan. This entry-level plan is very inexpensive, and it combines free telehealth with unlimited clinic visits. And the organization has a relationship with over 16,000 urgent care clinics around the country. The next plans are what we call limited benefit plans, or minimum essential coverage plans, MEC plans. You may have heard that term as well. But the difference between our plans and others that are on the market is that we offer them with unlimited doctor visits, and every plan has a generic drug component to it. All the plans have free telemedicine as well. The next level up is what we call our limited access major medical plans. These plans are in effect comprehensive major medical plans, but with limitations. So if you're going to see your doctor or a specialist, depending upon the plan, you're limited to either 10 or 12 doctor visits per family member each year. If you're going into the hospital, you're limited to either 7 or 10 hospital days per year. And there are a few other limitations as well, but all of the features of a comprehensive major medical plan are embedded into these two plans. And they include full prescription drug benefits that include generic and brand name drugs. The last level are our comprehensive major medical plans. These are identical in almost every way to plans you see from Cigna or Aetna or Blue Cross, except they are superior to those plans in one specific way. I mentioned about all the other plans. These plans also have zero deductible, first dollar coverage. And again, these are co-payment plans, not co-insurance plans. And they include full prescription drugs with each of the plans as well. The two comprehensive major medical plans are available either as with reference-based pricing or as a traditional PPO where the hospitals and the doctors are in a network. And that's so that we can offer these plans in areas of the country where RBP is not readily accepted. And then we have two types of comprehensive major medical plans: a zero deductible plan or an HSA qualified plan, which has a $5,000 deductible, after which everything is covered at 100%. So let me show you one little illustration to show you the differences and yet the qualities that set us apart from the other plans out there. So here's our IHP Ultimate plan. This is the richest plan that we offer. Zero deductible, $2,000 out-of-pocket maximum for a single, $13,500 for a family, and then zero copay for preventive services, zero copay for telemedicine, $20 or $40 copay for doctor visits, $400 copay for hospitals, including surgery, anesthesia, radiology, medications, room and board, everything, whether you're in there 1 day or 10 days, doesn't matter. $400 copay for outpatient surgery, $400 copay for emergency room, and a full prescription drug formulary. And there you see that these are the rates that you would get. I'm not going to show you sample rates and say that we'll do a proposal based on your group. The rates you see are the rates you get no matter where you are in the country, no matter the age of your group, no matter the health status of your group, okay? Now let's compare this to one of our least expensive programs, the MEC Enhanced program. This program, again, zero deductible, zero out-of-pocket maximum, zero copay prevention, zero copay telemedicine, $25 copay for unlimited primary care visits, $50 copay for unlimited specialty care visits. This plan has a $1,000 per day inpatient benefit and a $1,000 surgery benefit. Also includes a copays for outpatient lab, x-ray, major diagnostic, and a $10 generic prescription drug benefit. Pretty rich benefits for a limited benefit plan, but look at the premiums. Half the price of the IHP Ultimate plan. So this is just two of the plans that we have. We have others that are, as I mentioned, intermediate plans that have rates in between these two, and benefits that are a little less rich than the Ultimate, but richer than the MEC Enhanced. So to recap, it's guarantee issue. You can choose any 2 plans, any 3 plans, or any 4 plans, depending on how many employees you have. Same rate in all 50 states, same rate, no matter the member's age, sex, health, industry, or employer contribution. And most importantly for you, low stable annual rate increases averaging 2% for the past 5 years. Unheard of in the healthcare industry, all right? With that, I'm going to turn this over to Colonial Life and Accident, to Harris May and Patrick Salkin, my partners in crime, to show you how to further enhance the value of the employee benefit program. Harris, take it away.
Hello there. Let me just, if I may, just reintroduce myself. My name is Harris May, and I'm president of Daphne Financial Group. And Daphne is a supporting and supplier member of the association, and we represent Colonial Life. And Colonial Life is a major voluntary benefits firm. And I'm here with my associate, Patrick Salkin. Patrick is district manager at Colonial Life. Patrick and I are part of a 5-member team that works very closely with Stephen, supports him in his efforts to provide you with what I believe is probably one of the best healthcare programs in the industry. Before I start my presentation, let me share with you a disturbing statistic. 66.5% of all bankruptcies in this country are tied to medical issues, either because of the high cost of health care or time out from work. It's just a fact that getting sick is expensive. And because voluntary benefits directly deal with this issue, it is the thing which drives the demand for the product. And this will become clear as we go on from here. Please turn the page. Many franchise owners offer voluntary benefits to their employees as a standalone product. And this is a good idea in some circumstances. It's a great option if you don't have the means to fund a major medical plan. However, when a franchise owner pairs voluntary benefits with a major medical plan, they derive greater value. And also, they derive the flexibility to address the needs and concerns of their current employees and those that they seek to hire. For most franchise owners, the process of pairing major medical and voluntary benefits is very inefficient. And it requires an owner to find a major medical provider. Then they have to find a voluntary benefit provider, and then they have to coordinate it themselves. So the result may not be ideal. And this is the advantage that you have over your competitors, and an opportunity to create a better package than your competitors, because you have access to Stephen and a team of 5 colonial benefit specialists that can coordinate the entire process. And this process involves both the selection of plans, both the right major medical and the right voluntary benefit plans. It involves the arrangement for on-site enrollment specialists to coordinate both the major medical plans and also the voluntary benefit plans. And it involves helping you set up a free subscription to the Employee Navigator, which is an online HR management system that allows you to manage all your plans under one roof. Please turn the page. Now, voluntary benefits are insurance products offered by employees, but often paid 100% by employees. Well, this is a definition. The important thing is that why voluntary benefits were actually created. And the answer is they were created to help individuals and families avoid a financial crisis that often results from an injury or sickness. And this is what this financial crisis was causes so many people to go into bankruptcies. And if you think it's just the people of modest income, it's not. People that are making $30,000 a year, people making $200,000 a year can still find themselves in a very difficult time when it comes to paying all the cost of a sickness that the major medicals do not provide. So voluntary benefits help ease the fear among your employees of going into that, going into a financial crisis. Please turn the page. It's important to distinguish the difference between a voluntary benefits and major medical. Major medical plans are not designed to cushion the financial impact from out-of-pocket expenses that occur, such as deductibles, copays, travel expenses, childcare. By contrast, voluntary benefits are designed just for that purpose. Major medical plans pay money directly to doctors and hospitals. By contrast, voluntary benefits pay tax-free money, tax-free benefits directly to the insured, and the insured can use the money in any way they choose. Please turn the page. So why should you care? Everyone knows that in today's environment, workers are willing to move if there's an opportunity for improvement, more so probably than any other time. And your competitors will use that against you. All things being equal, if you're a spa owner, you are in danger of losing a worker who may walk out with 100 of their clients right down the street to one of your competitors that offers benefits. That's the same thing with nursing. If you're a home care franchise company and you employ nurses, you're fishing in the same pond as the hospitals for nurses, and the hospitals are going to be able to provide benefits. If you prepare the voluntary benefits with a major medical plan, you can compete head to head with almost any of your competitors. Please turn the page. So this is what it's all about. These are the benefits that you can pair with Stephen's major medical plans and the way that you can customize the benefits. Franchise owners can provide each of their employees the ability to choose which benefits address their personal needs. For example, if I am a person that has an active lifestyle, I have a lot of children and they're constantly going to the doctors or getting themselves hurt, I may want to have an accident plan. If I'm an individual that has family history with heart attacks or cancer or strokes, I may choose the critical illness policy, which can pay a lump sum payment, $25,000, $50,000, $75,000 when they are diagnosed with one of these illnesses that will help them sustain them while they get back to work. You may choose a life insurance policy if you need to have for final expenses. And it could go on from there. So when your employees sit down with our benefit counselors, they will have an opportunity to discuss each one of these benefits, to find out if these benefits are affordable, if these benefits are appropriate for their families, for themselves, and coordinate this with Stephen. Next page, please. What you're looking at is an example how voluntary benefits can supplement a major medical plan. On the left-hand side, you can see that Milo, in this example, received cash benefits for 6 treatments that they incurred, whether it be the accident or the emergency treatment for x-rays, lacerations, fractures. Each treatment triggered a tax-exempt payment to Milo's family. And in this case, it's a total of $755. On the right-hand side, you can see that Milo's parents were required to pay some co-payments. And those co-payments totaled $675. So, in effect, there was the entire sum of money that they had to pay for co-payments were covered by the voluntary benefits. Now, this is an example of a minor injury. If Milo had been unfortunate and had a burn, 2nd or 3rd degree burn, the voluntary benefits could pay anywhere from $1,000 to $15,000. If he broke a hip, it could pay as much as $6,000. And the list goes on and on. So please turn the page. So here's the process of creating a voluntary benefits plan. It's really easy and straightforward. You can get the ball rolling by just giving Stephen a call or myself a call or Patrick a call and start off with a 30-minute discovery call. And during that time, we will ask you a lot of questions to try to understand exactly what your situation is. We'll ask you questions about what your competitors are doing, etc. And then we will go on and schedule another call, another meeting, which will provide you some recommendations. If you approve those recommendations, we will then schedule the enrollment process. Next page. Now, we invite all the people that are on the call today, if they have any type of benefits in place, that we will be happy to do a benefit checkup for you. Okay, and this is the process. You just provide us with your current employee benefit booklets. We'll conduct a thorough analysis of your benefit program. We will then provide you a detailed report of our findings, and we'll get back with you. And we'll be very happy to do that and provide you an unbiased recommendations. Next page. So the major thing is that pairing major medical with voluntary benefits is really the ideal way to go. However, there may be reasons why a franchise owner may choose to offer major medical by itself, a standalone product, and there may be reasons for you to want voluntary benefits as a standalone product. These are some of the issues that we are able to discuss with you, and it's an easier process than as I mentioned, than your competitors, and we have a very large team to be able to work with you. So that is the end of my presentation. And here are some of the mugshots of at least four of the people who are who support Stephen on a regular basis.
Thank you, Harris. Now that you've patiently listened to our presentation, and we really appreciate the time you've given to us, it's your turn. So if you have questions, I'm going to see if there's, see some questions in the chat box.
Yeah, Stephen, what I'll do is I'll read through the questions in the chat because I got some directly to me as well. So first
Sure.
is when you say 2 lives, does that mean 2 employees or can it be an owner plus dependent child?
So it has to be 2 employees. That's a good question. They have to be 2 employees. The 2 employees can be husband and wife. They can be a husband. It can be an employer, an owner, and a child if that child is old enough to work in the business and have insurance. Certainly, they would qualify as the two employees as well.
Excellent. And then if we offer MEC to employees, does this disqualify employees from state benefits or Medicare?
It would if an employer offers any group medical plan to their employees and they choose to take that plan, then they do not get the Medicare plans or state benefits as well. And if you're referring to state benefits like the supplements that are offered to employees who choose health plans through the exchange, that's what I'm referring to. If you're referring to any other benefits, and I see CHIP there, that's one. They would still qualify for CHIP. They would still qualify for Medicaid benefits as well.
Okay. Does coverage include behavioral health?
It does. So in three of the plans, the 2 limited access major medical plans and the comprehensive major medical plan, we offer behavioral health benefits. They're limited to 20 outpatient visits per year, and that's pretty standard with all health plans. And then they have an inpatient benefit as well. Okay.
And then your contact information for how best to reach you to set up the call.
Great question.
I've got a slide for that.
I have a slide. There you go.
All right. Might as well leave that up while we go through the rest of these questions. Okay, some direct ones from Larry. How can I get group health insurance and for myself and a small amount of full-time staff? Sometimes there are as little as 2 full-time employees. Currently, we have 4, and my wife and I are 2 of them.
Okay. So as I said, the plan is effective down to 2 employees. So as long as you have 2 employees, you qualify. And
2 employees participating, or 2 employees even if only 1?
2 employees have to participate in the plan. That's a minimum number that has to participate in the plan. If for example, and I've had this come up in the past, employees leave for whatever reason, and you've gone from 2 employees to now 1 employee, the company will keep that 1 employee on for the balance of the year, and but must have 2 employees at renewal, or they will terminate coverage.
And in this scenario that was brought up, the husband and wife could be considered, they're both employees of the company. They can be considered two lives, even if they're on the same plan.
Correct.
Okay.
Correct.
Excellent.
Yep. And we have many situations where there's a family and one employee would enroll as an employee, and the other employee would enroll as an employee and child or children.
Okay. We have Kaiser in California currently for 65% of our staff, and then United Healthcare for the remaining employees in Nevada, Arizona, Tennessee, and Texas. What we are struggling with is that if we want to keep Kaiser in California, only UHC is willing to take the remaining insurance on, and all other carriers would want the entire policy getting rid of Kaiser. Our employees in California like Kaiser and want to keep it. So is this plan able to ensure all the other employees outside California and give us many more options other than United Healthcare to choose from?
Yeah, that's a great question. I have great experience with that exact problem with Kaiser people. Kaiser is a health plan that is multi-generational. People are in that plan from father to son. You know, they just love it. And I've had situations where I've gone up against Kaiser and we had to carve out the population that was in Kaiser. So with our plans, yes, you can carve out those in Kaiser. And of course, we'd give them an opportunity to join our plan if you wanted them to. But if they didn't, we'd carve out Kaiser and we would just enroll the people who are elsewhere.
Okay. Marissa asks, average health benefit cost per employee, what's not covered, can their spouses and dependents enroll? So I'm not sure if you need more information from on that one.
Yeah, I mean, I'd be happy. I gave you a very broad overview of the plans at this presentation for the sake of time. But I would be happy to speak with you and get on a call with anybody on this call today to go into greater detail about each of the plans that we offer. We offer plans that, as I said before, offer comprehensive major medical benefits, very similar to all the standard plans, Blue Cross, Aetna, United, Cigna out there today. But I'd be happy to talk to you about your particular situation and go through the plans in greater detail.
And the cost you showed on the screen were monthly costs, correct?
Those are for that particular plan, for those two particular plans, those are monthly costs, yes.
Okay. Will these benefits be available only to salaried employees?
No, they're actually available to salaried and hourly employees. And as I mentioned earlier, you can offer multiple plans and segregate the plan offerings by designation. You can offer certain plans to hourly employees and certain plans to our salaried employees. You can, there are many ways to carve this up. You can have one contribution for salaried employees and another contribution for hourly employees as well.
Okay. And then I forgot where I was going with this question. It was more just clarification. I'll remember it in a minute. In the interim, when I remember things, are all health insurance policies ACA compliant? Great
question. They are, yes. They all comply with ACA standards for minimum value plans and essential coverage plans.
Okay.
In all 50 states.
Barton has two separate EIN LLCs. Can he combine them to get more options, or are they treated separately?
If they're similar businesses or the same business, just with two different numbers, yes, they can be combined.
Okay. Don, I think he's confirmed, to answer yours, there is no minimum participation beyond having two enrolled employees.
Correct.
Right. Okay. If a hospital rates are above RBP rates, is there a potential for someone to ever be exposed beyond the OOP max, out-of-pocket max, in the IHP Ultimate Plan, for instance?
Okay, so I'm going to answer this two ways. Every time you go into a hospital, you are required to get pre-certification, there's an 800 number that your doctor would call for pre-certification. Once you've done that, They've gone through the pre-certification process, and the IHP representatives speak with the hospital representatives and come to agreement. You are only responsible for the copayment. The same would hold true in the case of an emergency situation. If you're in a car accident, if some other kind of emergency arises where you have no choice what hospital you're going to go to, the plan will cover you as if you had pre-certification, but they will move you to a hospital that they've negotiated a better rate with when you are able to be transported. The other situation can arise with our limited access major medical plans. If you're in a plan where you have 7 days in the hospital per calendar year, and let's say for whatever reason you're in for 10 days, after 7 days, you're not going to be covered by the copayment any longer. You're going to be paying the hospital rate, but you will not pay the retail hospital rate. You will pay the reference-based pricing, or the Medicare rate, or whatever the rate is. That's 150% of Medicare, which is a fraction of the retail price. I'll give you an example. I was hospitalized last year, and I had surgery, and my bill came to my house, and it was $150,000. But I have Medicare Advantage plan, and the Medicare Advantage plan sent me the bill, repriced, and that $150,000 bill was repriced at $12,000. So whatever you would be paying out of pocket would be a fraction of the retail cost.
Okay. And then Bob Pervin just reminded me of the question I forgot. So thank you, Bob. In these plans, the employer can decide how much, if any, they contribute to the cost of medical care for their employees, correct? So if I, as an employer, don't want to participate and contribute anything, that's my choice. Or if I want to cover based on some calculation of how much time or whatever my calculation is, I can do that as well, correct?
That's correct. That's correct. And I wanted to mention one other thing. Colonial Life has a number of voluntary programs, like an accident program that pays you, the patient or the member, a flat dollar amount for a particular incident. And if you were in a plan, one of our plans that did stop paying benefits after 7 or 10 days in a hospital, they have plans that can pick up that amount of money or offset the amount that you would pay out of pocket considerably. So I would encourage you to talk to them about that as well.
Yeah, and I want to just highlight that this is one of the benefits of that we provide to our AAFD members here, right? The scenario both with Stephen and Harris, what they've talked about, this is a huge win for us as franchisees, and certainly as a benefit of being part of the AAFD, because we have access to this type of medical plan. A lot of our small business peers out in the marketplace don't have this, and they're paying market rates. So just keep that in mind. This is one of our benefits. This is one of the benefits of having Stephen and Harris on our team here to support us. With that said, Stephen, I want to highlight. Oh, let me ask this other question before I forget. Do any of the plans protect against Part B penalties?
Yes, all the MVP plans, the Ultimate, and the Plus and Premier protect against Part B penalties.
And then I think one of the other questions that came in is just, highlight the telehealth side in terms of the cost for the AAFD participants versus what could be costing folks out there in the full marketplace.
Sure. So all the plans that I mentioned today have free, unlimited telehealth benefit built into the plan. That's a great benefit because many times, it's a night or a weekend, you don't want to go to an urgent care center. You don't want to spend the money to see a doctor or go to an emergency room when you can have a medical professional give you advice that may redirect you somewhere. and even provide medication until you're able to see your personal physician. So that's a great benefit in and of itself. We also have another benefit, a freestanding benefit for some people who have employees who may not have the finances to pay a monthly premium for a medical plan, even a limited benefit medical plan. We have a plan that we call Basic Care Plus that combines free unlimited telemedicine with unlimited urgent care visits at over 16,000 urgent care centers around the country. So that's a great benefit. It's very inexpensive. It's voluntary, and it doesn't require that you be a W-2 employee. It's good for 1099 employees, part-time employees, and it's a great benefit to offer those cohorts without any large outlay of funds on your part.
Okay. I see Bob's come on screen, and before I just see if Bob wants to share anything. If you have any, I think I got all the questions in the chat box that were submitted. If there's any other questions that we missed or that you have, we've got a few minutes left here before the top of the hour. Please submit them in the chat box and we'll be sure to ask them. Bob, anything you wanted to share?
Sure. I appreciate a great presentation and the folks that have joined us. I do want to stress two things that were mentioned that I think really set the AAFD plan apart, that I'm just extremely proud of that we've been able to accomplish. Primarily, with all of our plans, you as employers have discretion over how much money you're going to contribute. That is something that I've just never seen before. So in most instances, you're going to want to pay the premium of your employee. You may not want to pick up the premiums for their family members or spouse, and you have that option. I'll have that option under all these plans, including the telehealth plan. And there are three tiers in the telehealth plan that I may have missed if Stephen mentioned them. But the lowest tier is only to AFD members is only $15 a month. It's about a 25% discount over what Convenient Care Plus would charge to somebody on the open market. So it's a significant discount. But again, the employer can determine if they're going to pick up that $15 or if they're going to pick up some portion of it. You have that option. And then there are intermediate plans that brings the cost, I think, up. And Stephen, you'll go in and correct me, but there's a $25 plan and a $40 plan that just have richer benefits, including live clinic visits. It's just an incredible benefit if you're striving to want to provide health care for your employees, but can't afford what we consider a very reasonable cost. You have a huge amount of options under our program.
Thanks, Bob. Yeah, 75% of all medical encounters take place at an urgent care center. That's an interesting statistic because if you're like me and you call your doctor for an appointment, it's like 3 weeks away. So I'll go to my nearest urgent care center for a scrape or some other minor condition that I know they can correct, and this program offers that service for either free or a $30 copay, depending upon the plan that you choose, along with free, as Bob mentioned, free telemedicine. So great benefit at a very modest price that would be a great benefit to offer those employees who are either 1099 part-time or couldn't afford the cost of one of the other plans.
And I guess the last thing that I would mention is that, because I think it was well covered, but depending upon how you're budgeting, you're able to marry the Colonial Life plans with one of our health plans to really provide extraordinary coverage for, I think you'll find substantial savings over what most of our members tell us that they're paying for similar care or have avoided getting care because they just simply couldn't afford it.
Yeah. The bottom line is that we're all about choice. We're giving you choice in the number of major medical plans that you can offer employees, the amount of contribution, if any, you can provide to your employees, and marrying that with voluntary benefits through Colonial Life that you can choose to either contribute to or not, and allow the employee to decide whether he or she wants to add that particular benefit to their core medical program. What you're giving them really is the optics of what you're giving them is what I wanted to say, is that you're giving them all these different choices, and choice is always good, and it's a very attractive for employees, and serves to attract and retain the best employees out there.
And as we, thank you, Stephen, as we get close to the end of the hour, I don't see any other questions. So what I'm just going to do is reinforce that if you have any questions whatsoever, reach out to Stephen and or Harris. They'll be happy to answer your questions. But I would encourage you at least to ask the questions to see if what you're providing now or what you have now makes sense based on what you can get through this program. Again, it is a very price aggressive program from the perspective of us as small businesses. Some great savings there, some great coverage there for the prices you're paying. I know that because my wife's a school nurse and we're on a state level plan. And let me tell you, this is more than competitive with even that plan. So take a look at it, ask the question, see if it's right for you. And if it is, great. If not, give Stephen the feedback of what you have that might be better. I'm sure he's always open to see what other plans are offering out there because it's part of what he does. But take the time to take advantage of this opportunity that we're providing through the AAFD as part of your membership. For those who are registered, we will be sending the recording out to you, so you'll have access to it following this call, so you can review it again if you want, share it with your significant other, business partner, whatever it might be. And again, I just encourage you to look a little deeper into this as an opportunity for you, your employees, and your family. So with that said, Stephen, Harris, and Patrick, thank you very much for what you've provided today. It's a great resource, again, through the AAFD, and looking forward to hearing some of the success stories about it.
Thank you so much.
Thank you, everyone, for joining the call today. Appreciate your time.
Thank you. Have a great day.
Bye.
Everyone.